Welcome to OakLeaf Surgical Hospital. We look forward to meeting you for your upcoming surgery. In this video, you will find useful information for you and those helping to take care of you when you are home. Some items we will cover in great detail, and others you will be just introduced to, as they will be covered in more detail during your stay. If you find you have questions about home safety, equipment needs, or the ability to manage the post-operative routine, we suggest that you speak to your physician about a pre-operative physical therapy visit. At that visit, a physical therapist can educate and assist you in getting your discharge planning for home all taken care of, including a walker, crutches, bathroom equipment, and to teach you your exercises. Some individuals also need extended stay at a rehab facility to gain independence. Please speak with a discharge planner at OakLeaf Surgical Hospital regarding this. The more you are educated and prepared, the smoother the hospital stay and rehab at home will be. With each session of physical therapy at the hospital, you will practice a series of exercises. These exercises are meant to build up your strength surrounding your hip and prepare you for the next phase of exercises that comes during outpatient physical therapy. We recommend that you attend physical therapy when you leave the hospital to help complete your rehab for strength, range of motion, balance, coordination, and community activities. We want you to get back doing everything you want to do. We are going to start with an exercise to help improve your circulation and reduce your swelling. So we're going to start with some ankle pumps. I'd like you to pump your ankles up and down, and you can go ahead and do it on both sides, your surgical and your non-surgical side. Pull them up as far as you can till you feel a stretch, and point them all the way down like you're pressing the pedal on the gas. We want to do 10 to 20 repetitions every hour that you're awake. Next, we're going to move on to the quad muscle. Quad muscle is on the front of your thigh. So what I'd like you to try to do is tighten up that quad muscle and push your knee down into the mattress of the bed. You'll find that doing your exercises on the bed is going to be the easiest place. Now hold these quad sets just a little bit longer and relax. Tighten and relax. Tighten. And one more. And go ahead and relax. 10 repetitions 3 times per day for this exercise. The next exercise is going to be for the muscles surrounding your hip. This is close to where your incision is, so it can be a little bit more sore, but it's important to help for your sit to stand and getting out of bed. So we're going to tighten up the gluteal muscles. You want to do both sides for this one. So go ahead and tighten the muscle and relax. Tighten and relax. A little bit slower. Tighten and relax. That's better. One more. Excellent. Now it's important to remember that you'll get some handouts to take home with you so that you'll be able to follow through that handout and know exactly what to do at home. Next exercise is called a heel slide. The heel slide is meant to produce some range of motion and stretching for the knee and the hip. Now, if you have any range of motion restrictions, your physical therapist will let you know that as you continue to progress with these exercises. But what we want to start with is just stretching the knee and the hip to tolerance, no pain, okay? So I'm going to have you go ahead and bend your knee and slide your heel on the mattress to where you feel a stretch and then come back down. Now, you might feel the stretch anywhere from your hip through your thigh. So anytime you feel that stretch, then you can go ahead and just straighten your leg back out. Go ahead and bend your knee and then back down. Now, if your mattress is really soft at home, you might need something firm like a piece of plexiglass or even a baking sheet underneath your heel, and that can help create less friction so that you can do this exercise a little bit easier. I'll have you do a few more. One more. Very good, and let it rest down completely. Oftentimes when you lay your leg down flat, you'll also feel some stretching across your front of your hip. That is all very normal, just due to the swelling, the bandages, and the fact that you've been laying in bed for a couple hours. Next exercise is going to be a slide moving from the inside to the outside. Okay, so we're going to go from the midline of your body to the outside of the mattress. Again, you don't want to have any pain. You want to have some stretching, and you'll probably need a little help with this one as well from a family member. So let's start by sliding your whole leg out towards me. Okay, and now let's slide back to the midline. Yep. And out towards me. And back. And out. And let's do one more. Out and back. Good. We've got 2 exercises left to go. For the one, we're going to use a coffee can. We'll be able to get you a can like this when you go home, so you can take this one right from the hospital here and take that home with you. So let's go ahead and bend up your knee and get that underneath your knee. And what you want to do for this exercise is you want to use the muscle on the front of the thigh, and you want to go ahead and just straighten out the knee. Brief little pause at the top, and then come back down. Yep, up and down. Up. And one more time. Good. Rest that leg down. All right. Pull that coffee can out. For this next exercise, we're going to have you sit at the edge of your bed. So first what we're going to do is we're going to help you get to the edge of the bed. And then once we're up and sitting, we'll do the exercise itself. So from getting from the middle of your bed to the edge of your bed, I'm going to have you bend up your non-surgical leg. Yep. And I want you to scoot your bottom over towards the edge. Yep. Now bring your surgical leg over a little bit. Scoot your bottom maybe one more time. Excellent. Okay, now you can start to drop your non-surgical leg, your good leg, over the edge. Use your hands, your elbows, start to push yourself up. And you may need someone to then help assist your surgical leg. You may also be able to do it yourself. So go ahead and keep coming into sitting. Don't forget to bend your knee. There you go. And then just let that leg relax and hang there. Once you're situated there, the exercise itself is to go ahead and straighten out at the knee and then go ahead and bend your knee. Yep. So you just want to use this mechanism here. Relax your hip and bend and straighten at the knee. One more time and relax. Again, for all of these exercises, except for the ankle pumps, you'll do 10 repetitions 3 times per day. So I'm going to lower your bed down, and then we're going to get up and we're going to go for a walk.
Okay.
All right. So you just hang tight there. All right. Ready to go for a walk. So we are going to use this front-wheeled walker. I understand you've got one of these at home ready to use, and this is the kind that is going to be the safest for you right now. So we are going to work on standing up. Now it's important to remember that after that hip surgery, to be a little cautious. So when you stand up, I want you to stand straight up. Don't lean forward at the waist and then come up. I want you to stand straight up, and you can use your hand on the mattress to help with that. So I'm going to have you put one hand on the walker, one hand on the bed. You can use both legs to push with. You are weight bearing as tolerated, which means you can step on that leg with enough force to give your body support, but don't cause any pain. Okay, so I've got this belt around your waist so I can help you with standing as well. So why don't you go ahead and stand up and get your other hand to the walker and just kind of get your balance there. And our first couple steps are going to be small, short steps, but I'm going to have you move the walker forward, and then that surgical leg goes first, and then the good leg. Okay, and then the walker and the surgical leg and the good leg. And let's just take one more step. Walker, surgical leg, and good leg. So when you are standing, the crutches should hit against your rib cage, and you should have a little bit of a bend in your elbow so that you can stand up nice and straight. Okay? Now again, your weight bearing is tolerated, so you can use your leg to help support you. So I want you to go ahead and move the crutches forward, and then the surgical leg, and then the good leg. and then the crutches, and the surgical leg, and the good leg. And let's do one more step. Crutches, surgical leg, and good leg. Your mobility is very important to us, and we want to make sure that you choose the right assistive equipment for at home. So we have chosen a walker with wheels on the front of it. You may have seen friends of yours, or you may even have other options of walkers at home. There's walkers with no wheels on them, and those are often a little cumbersome, a little slow, and don't let you move very fluidly. They also make walkers with the 4 wheels on them, with the seat and the brakes. Those are a little too loose and a little too unsteady and therefore unsafe when you're walking. So this really is going to be your best option. If you have a walker where you can swap the wheels out, you can often purchase those at the drugstore, or you can sometimes pick up parts and pieces at secondhand stores or community loan closets. You have lots of options, but let's practice with this and see how you do with that. So we are going to work on just trying to walk a longer distance, like down your hallways at home. So your best option is going to be to push the walker forward, move your surgical leg forward, and then your good leg. And then just push the walker right along, move your surgical leg, and then your good leg. Yep. And continue to push. And this allows you to kind of have a nice, steady, even pattern without having to get hung up on carpet and different concerns. This walker will push right over any surface. Perfect. Crutches are also an option for you to walk with. Sometimes people like them when they're, in tighter spaces, again, kind of like in the bathroom areas or in through small kitchens. Some people also just like to have one set on one level of the house and the other set on the other level of the house. So you have many options for getting around. But the pattern with the crutches is the same as with the walker. It doesn't change. You're just using a different device. So you want the crutches to go forward. The surgical leg should land right in between the crutches. Yep. Bring your good leg forward. Bring the crutches forward. Surgical leg, and then good leg. Good. Let's take one more step. Perfect. All right, we are going to practice the stairs. And one of the questions a lot of people have is, can I do the stairs? Is it safe to do the stairs? And the answer is yes. We will teach you how to do the stairs. And in fact, we want you to do them so that you have your independence. Some people need to look around their house and look at where they're going to enter the house, or if they need to get to a different floor of the house and install a rail. Doing the stairs with a rail and one crutch is probably the safest, most secure way to do that. So if you have someone who can install a rail on your front porch or going up to your main living level that's sturdy, I would go ahead and do that. So let's practice this pattern here. You're going to have one hand on the rail and obviously your crutch in this hand. And what we're going to do is we're going to go up with your good leg first. That good leg is going to take the first big step for you. So go ahead and go up with your good leg, push up, bring your crutch up, and bring your surgical leg. Yep. Go up with your good crutch and surgical leg. Okay. Go ahead and walk across this platform. I'm going to have you go down with your crutch, and your surgical leg goes next, and then the good leg. Yep. Crutch, surgical leg, and then the good leg, and then crutch, surgical leg, and the good leg. And then someone can either give you your other crutch, or maybe your walker is waiting here for you, and then you can continue on your way. Okay. There'll be times when maybe you're outside of your house, out in the community, or maybe if you need to navigate a curb, that there's not going to be a railing for you to use. So using 2 crutches is the pattern, or is the option, I guess, that you want to use. So when you're going up the stairs, you still want to go up with your good leg, then the crutches, then your surgical leg. So let's go ahead and practice. Up with your good. Oh, bring those back down actually. Keep your leg right there. Stand up with your leg and bring your crutches up. There you go. So go up with your good. Yep. All right, walk across the platform. You're going to want to come down with your crutches. Surgical leg is going to come down first, and then your good leg. Surgical leg. Crutches, surgical leg, And then your good leg. And now you're all set. Now you can just take off walking. All right, we are going to practice sitting down on this toilet. We took a standard toilet and put a commode with handles over the top so that it's a little easier for you. Now, you don't have any restrictions against sitting, but it's nice to have it for safety and for comfort. So what I'm going to have you do is reach back for the commode handle with one hand. Yep. And put your surgical leg out in front of you just a little bit and then lower yourself down. Yep. And then when you're ready to get up, you can put your hand back on the walker and push up with both legs. Yep. And so that's really pretty easy. You shouldn't have too much trouble with this at all. You will find in your joint venture handout that there will be a lot of information regarding shower equipment. Some people have walk-in showers or stall showers. Other people have the traditional tub shower combinations. What's going to be important for you is to look at your house and see how much equipment your bathroom can tolerate from a size standpoint. They make tub benches. They also make extended tub benches that can sit with adjustable legs on the bottom of the tub, the bottom of the shower, or partially in either option. A lot of times, if people aren't sure what to do, your best person to talk to is going to be your local physical therapist that you're going to be working with after surgery. They can help navigate the equipment that's available, where it can be rented or purchased, or sometimes even borrowed through community loan closets, and help get that adjusted to make sure that it fits you from a size standpoint and also fits well within your bathroom. All right, as we get ready to leave the hospital, we want to make sure you've got enough independence to get in and out of your car safely. So let's start walking towards the car to practice. We also want to make sure that you can get to and from your physical therapy and your doctor's appointments. You will need a driver for the first few weeks, but you'll be able to ride in the passenger side of the vehicle. A little practice getting in and out will help make you feel comfortable. We have reclined the seat and pushed the seat all the way back. So I'm going to have you walk up to the car. You're going to go ahead and turn, until you're facing the side of the seat. All right, step back as far as you can, and you're going to have to try just to perch on the edge of the seat, and then I'll help with your leg. So let's get a hold of the console. All right, use your good leg to boost up and slide back. Yep. And then go ahead and spin that leg into place. Go ahead and you can start to scoot yourself to the edge of the seat. Bring your leg over. Keep scooting. Yep. Slide to the edge. Yep. Get your hand on the walker and push up through your good leg. Hopefully the information you've gained here today has been helpful to you and your family members as you prepare for your upcoming surgery. If you have any questions regarding any of the information, please reach out to one of your providers. On behalf of OakLeaf Surgical Hospital, we wish you the best for a speedy recovery.